28.8 million Americans every day. This bleak picture of underrepresentation of eating disorders on the worldwide scene clearly clashes with scientific evidence on prevalence and impact of eating disorders, says Nadia McCauley in the article What's Weighing Us Down? Closing the Gap Between the Global Burden of Eating Disorders and Their Representation. In recent years, eating disorders have become more and more prevalent in everyday life. Because of this, there is an extensive amount of research going into eating disorders and everything surrounding them. In this speech, I hope to be able to effectively teach you about eating disorders. I will tell you about the different types and causes of them, along with treatment options and even a third-person account of someone experiencing one themselves. First things first, what even are eating disorders, where did they come from, and how were they first started? Well, for a simple definition, an eating disorder is a mental condition affecting people's eating behaviors in a dangerous and unhealthy way. Eating disorders can be traced back all the way to the 1960s, originally starting in Western societies. Women were beginning to starve themselves, sometimes even to death. In the following years, more and more women started idealizing this skinny look that these sick women were getting. Eventually, they realized they could just eat whatever they wanted and then burn it off or get rid of everything in other ways when they were done. So eating disorders were born and only progressed from there. As I mentioned before, there are many different types of eating disorders, and all of them affect the individual in different ways. The first one we'll talk about is anorexia nervosa, and as it's more commonly known, anorexia. It's a highly distinctive, serious mental disorder, as stated by Wissam Zahm in Overview on Eating Disorders. Anorexia can come in two different forms, the first one being RAN, also known as restricting type anorexia. The individuals struggling with this disorder in specific are losing a lot of weight by eating little to no food each day and getting an excessive amount of exercise. The other form is called BPAN, also known as binge eating / purging type anorexia. And these individuals will also restrict the amount of food that they're consuming and exercise regularly, but they will also go through short periods of binge eating and sometimes even purging, which is the process of cleansing or removing food from the body, such as by regurgitating or throwing up. The next one that is most commonly known is bulimia nervosa, or better known as bulimia. It is described as a serious, potentially life-threatening eating disorder. It is characterized by a cycle of compensatory behaviors such as self-induced vomiting designed to undo or compensate for the effects of binge eating. Another form of bulimia nervosa can be excessively exercising or fasting after binging in order to again make up for the mass amounts of food being consumed. Each of these disorders is only diagnosed if the cycle is occurring 2 or more times throughout a week, meaning it doesn't get diagnosed very often. The third eating disorder is different from the last two that I talked about and is actually the exact opposite. This one is referred to as binge eating disorder and has a very specific list of criteria that everyone needs to be experiencing before being diagnosed with it. The list of criteria includes consuming amounts of food much larger than average, eating until you're uncomfortably full, consuming food even when you're not hungry, eating food much more rapidly than normal, avoiding having to eat with or in front of others, and lastly, having a binging episode at least once a week for 3 months or more. The last eating disorder I'm going to talk about is called EDNOS, and it takes up more than 50% of all eating disorders that have been diagnosed. It's also known as eating disorders not otherwise specified. And this is basically just all the individuals struggling with an eating disorder, but they don't necessarily meet the diagnostic criteria for bulimia or anorexia, but they're still experiencing symptoms to an extreme extent. Now that we've talked about the different types of eating disorders, it's important to understand where and how people get these eating disorders in the first place. They do not form unily in all cultures at all times, says Janet Palvey and C. Peter Herman, the psychologist who conducted the study Causes of Eating Disorders. Interestingly enough, it's believed that in cultures in which food is more abundant, the ideal body image is slim, whereas in cultures where food is more scarce, it's more desirable to be rotund or plump. And this suggests that what is more difficult to achieve is what's more desirable for people. But determining set causes can be close to impossible when we're trying to find the causes of eating disorders. While there are many correlations relating disordered eating and these outside factors, it's not possible to decide what the causes are, but with multiple correlations line up with having the same disorder, it's definitely worth noting. The biggest correlation being found, which comes as no surprise, is the media exposure. We all know by now how unhealthy it is to be staring at unachievable images of bodies. Everyone is guilty of getting sucked in at least once to scrolling nonstop on someone's page who they wouldn't mind looking like. Seeing hundreds of men or women showing off their perfect bodies has been proven to be unhealthy and almost motivate people towards looking a different way. Lastly, the family correlations. It's not hard to see when someone is losing an immense amount of weight. And at the beginning, family and friends are proud of the individual for having self-control and self-discipline, even praising them for the way that they now look. In most cases, they are the main motivators behind these eating disorders and play a huge role in encouraging these unhealthy habits without even realizing, until it's too late, of course. But that brings me to the next topic, which is treatment options. Unfortunately, as stated by Taylor E. Penwell in the study, Traditional versus Virtual Partial Hospital Programs for Eating Disorders, Feasibility and Preliminary Comparison of Effects, more accessible forms of evidence-based treatment for eating disorders are needed, especially since a large proportion of individuals lack nearby options for care. Meaning, while yes, there are multiple options for eating disorders, they are typically very limited and not exactly easy for the individuals to find. The different treatment options include medications, family-based therapy, inpatient treatment, and outpatient treatment. Medications are generally only found to be helpful when dealing with bulimia and binge eating disorder. These medicines most commonly used are antidepressants, antiepileptic medications, anti-obesity and stimulant medications. While different medicines have been found to treat these disorders, there's almost no medication for anorexic patients or anyone struggling with that. Fortunately, though, family-based therapy has been proven to be helpful among most anorexic patients. The therapy is focused on addressing the issues believed to contribute to the patient's disorder, focusing mainly on not blaming anyone in the family and using them as a support system during this time of recovery and having everyone learn together. But this is not the only treatment option for anorexic patients. Another one is inpatient treatment. This is only used when the patient is very seriously ill and may need special medical attention throughout their treatment. They're fed through feeding tubes called nasogastric tubes, which go in through your nose, down your throat, and into your stomach. Thankfully, as uncomfortable as this sounds, it has been proven to have patients report feeling less abdominal pain and nausea, resulting in a faster and smoother recovery after receiving this treatment. The last option is for anyone struggling with any eating disorder, and it's outpatient treatment. The individuals will be assigned a nutritionist to help set up a plan to meet both their caloric intake and nutritional goals. While this has been found to be effective for some patients, in most cases they report needing more help than just a written nutrition plan sent home with them. Throughout my speech, I explained the different types of eating disorders along with their treatment options, as well as exploring options for the disorders and sharing a true story about a recovering Eating disorders are not a light issue and definitely need to be brought more attention to, so thank you for listening to my speech.